Find the ASISs. Now the way he's lying on the table, what's the angle of his anonymous relative to the sacrum? What do they look like? Like this, right? Sitting like this. So let's say my middle finger is his ASIS, right? Sacrum's down on the table between my heels and my hand, all right? So what I'm going to do is come out on his ASISs, and this is iliac distraction, and I'm basically going to push and try to flare them more in external rotation. And some people will cross the arms, and this is fine. You can do this in through here, okay? Now, if they're really tender, what you do is, let's say we do it this way. Put your hand on top of my leg, okay? If they're ticklish or anything like that, you have their hand go on top of yours, okay? Don't put their hand on their ASISs and then you put your hands on top, okay? Because you're trying to feel for things, not through their hands, okay? So that's, even abdominal palpation, it's the same thing. You have to be the one feeling, and they put their hands on top of yours as you go around and palpate, okay? If they're really touchy and ticklish, all right? So that's distraction. I'm trying to flare the anonymous relative to the sacrum more in external rotation. So what part of the joint does that stress more? Anterior or posterior?
Posterior.
It gaps the anterior, so it would stretch those, okay? But it would also compress the what? The posterior aspect, okay? So with this, if you can get a side, great. If you get front and back and a side, more power to you. But most of the time it's just left or right, okay? So that's distraction. Roll up on your side and face them. Come back towards me a bit. Okay. This time you want to get on the lateral aspect of the ASIS. Okay. Try to keep them as perpendicular to the table as you can. So don't let the pelvis roll. Okay. His ASIS is here. Okay. So I'm going to come just lateral to it. And I'm going to press lateral to medial into the table. So what kind of influence does that have on the innominate? It'll internally rotate the innominate, and that gaps what aspect? Posterior aspect compresses the anterior aspect. Once again, if you can get a left or right, awesome. If you can get a front or back and a left or right, that's even better. Okay? So these will be done on both sides. What's happening to the other side? Yeah, it's doing the same thing to the downside, but it doesn't have the same concentration of pressure because the table's kind of absorbing some of that, okay? So all we're trying to do is stress the SIs in an internal or external rotation, okay? Flare in, flare out, okay? Cool. What's after compression and distraction on the exam form? Yeah.